It should be remembered that President Yoweri Museveni in August 2021 directed the Prime Minister and the Ministries of Health, Finance and Public Service to increase the monthly allowance for intern doctors from 750,000 shillings to 2.5 million shillings, a thing that has not been implemented up to date.
We are here to remind the government of the Presidential Directive of 2021 to pay interns half their salary and to deploy them. The country is bleeding. Muzeyi, let them respect your directive. Fetuli bazzukulu, we are not activists, we are only demanding for what you promised us.
Yesterday, while releasing the budget for the third quarter of the financial year 2023-2024, amounting to 4.974 trillion shillings, the Permanent Secretary, Minister of Finance, Planning and Economic Development Ramadan Gobi, noted that there is no money for increasing allowances, especially when the nation is grappling with dates.
Please tell them there is no salary enhancement because there is no money for such things at this point in time. The money we have now is actually to make us live within the means that we have now. Okay? Because if we are to give them any salary enhancement, it means borrowing. And we don't think it is wise to borrow money to pay salary.
Now this has fueled the ongoing arrangements by intern doctors to lay down tools on 1st February this year. Today, Church of Uganda Family TV engaged the Treasurer for Federation for Uganda Medical Interns for me, Dr. Oscar Melvin, who in this May stressed the importance of prioritizing the health sector, sidelining what the Permanent Secretary spoke the day before.
We witnessed or had the Permanent Secretary, Minister of Finance and Treasury talking about the absence of funds for medical interns. But it's the same ministry that releases money to other departments. And I think as a country we have a direction that we are moving on. We should have our priorities. Us as citizens, we think health sector is one of the parts that should be facilitated. We get amazed from the same information that medical interns currently need around 20 to 30 billions only for the areas and whatever.
Oscar listed some of the work medical interns do, highlighting the great role they play in hospitals since they occupy 60% of the workforce there within.
As the medical interns, we're covering medical emergencies, pediatric emergencies, including surgical emergencies and surgical emergencies. And we're the first frontliners of these facilities, national referrals, regional referrals, And we are covering this, includes the common person, the middle income person, the first class person.
He also stated that Uganda medical interns get the lowest allowances compared to the colleagues in the region. This, according to him, hinders the growth of the science sector.
The medical interns of Uganda are the people who are getting the cheapest stipend or allowance. In Kenya, medical intern in Kenya is getting around 3 million Ugandan shillings. In Uganda, in Tanzania, they are getting more than that. In Rwanda, it's only Uganda that it was even trying to be removed. Science world, we are moving into robotic science. People are moving to planet Mars. But for us, we are still even failing to maintain the 60% workers of this country. There is no way you can get a cheap service. There's no way you can get someone providing you that service.
Since it was a directive from the president of the country, these interns have vowed not to look back on their decision of laying down their tools effective 1st February 2024 until their concern is addressed.
Come 1st February, if this is not addressed, we are putting down our tools until this further notice, until this issue is worked on. We are working on something legal. We are not asking for increment. The Permanent Secretary who was saying that they have no money for increment. We are not asking for increment in this regard. We are asking for something which was present and was downplayed illegally.
As tensions escalate, the medical internees ultimatum places the spotlight on systematic issues within the healthcare system, emphasizing the urgent need for resolution to ensure the well-being of both healthcare professionals and the patients they serve. Story compiled by Luke Majumbali Naitwe for Church of Uganda Family TV News at 8.